I think it's important to explain what the MIIUs, or Minor Injury and Illness Units, in Gloucestershire are. These are units that treat minor illnesses and minor injuries. They are not accident and emergency departments.
Last year, the Care Quality Commission inspected services across Gloucestershire Care Services, and in particular they raised some concerns about our minor illness and injury units. We've been working on the plan ever since then to bring those units up to a standard that the CQC requires us to have. In particular, we've looked to increase the number of nurses on duty, to always have an emergency nurse practitioner on duty, and to ensure that services are always staffed at that sort of level.
We continue to monitor attendances at all our minor injury and illness units. Our teams see over 70,000 people a year, which is not insignificant. What we also have been looking at is our activity overnight, particularly at Stroud and Cirencester, and the evidence is very clear, they are incredibly low.
In terms of absolute numbers, between 1 and 2 patients present to Stroud and to Cirencester between the hours of 11 p.m. and 8 a.m. That's an average that's persisted for the last 3 years. I've looked at the patients presenting over that 3-year period, and many of those patients have minor illness or minor injuries that are not of sudden onset, have not come on that evening, and can wait easily until the next morning. Some patients have attended our minor illness and injury units inappropriately, and what I mean by that is that they have injuries that are severe or illnesses that are serious and actually should have attended a major centre, an emergency department or A&E department. Those patients therefore have their treatment delayed.
And it's also about us producing a service that we can actually find staff to work in. We've had real issues with our overnight service over the last few months. People just don't want to work in MIIU overnight. There's not enough happening, there aren't enough patients going through, they find it unsatisfying, and professionally it can be disabling for them to see so few patients. So what we've done is we've produced an engagement exercise over the next 6 weeks. We're going to the public, we're going to stakeholders, we're going to colleagues in the Trust and asking them to look at 3 options for our continuing services going forward. But importantly, in all of those options, there is no opportunity to have the overnight service anymore in Stroud and Cirencester. We really feel that that service has served its time and needs now to close. There are lots of other alternatives available, and if people have got concerns or anxieties during the night, they live in Stroud and Cirencester, they're not sure what to do, then what they should do is what everybody else does in the rest of the county: ring NHS 111.
This process is absolutely not about cost cutting. The options that are on the table all have cost implications. All of them will cost this organisation more money. I'm the medical director of this trust, and I also work as a GP, and from a patient safety point of view, I could not support cost cutting for urgent care.
The work we're doing around our minor illness and injury units takes place in the context of a much bigger piece of work that's happening across the county. There are 2 things that are currently going on that potentially can have an impact on how MIIUs work in the future. One is a review of urgent care services that's being run by the Clinical Commissioning Group, which is due to begin to start reporting later this year. And the other is the piece of work that we've been doing in the Forest of Dean, where we've been engaging with local people about their concerns, about their issues, about how they'd like to see health services shaped. So it could be at the end of this process, the end of those 2 processes, what we do in our MIIUs is slightly changed, is slightly affected. But we feel it's so important now and so urgent that we make a proper response to the CQC recommendations. We're pressing on with these changes to MIIUs now.
Everyone's feedback is really important as part of this engagement exercise, so please do provide feedback through either attending our locality sessions, accessing our website, which is www.gloss-care.nhs.uk. We look forward to hearing from you.